Case Study 11, Heartburn, by Katie Gray, David Kim, Emily Lika, Charlie Liggett, Sam Prouty, Alicia Slater, and Mina Vang. Description of patient and reason for encounter. Description: A.B. is a 60-year-old male, unknown race, who returned from a visit to Italy last week. A.B. enjoys swimming for his exercise and joint health. A.B. complains of heartburn symptoms that have recently worsened. A.B. has been replicating all the wonderful pasta with lots of tomato sauce since returning from Italy. A.B.'s family support, employment, insurance status, special needs, attitudes, beliefs, and behaviors, and social drug, alcohol, and tobacco use were not assessed at this encounter. The reason for encounter is A.B. is in need of a drug product recommendation for his heartburn symptoms.
Medication history and family medical history. A.B. has no known drug allergies or adverse drug reactions. No family medical history obtained during this encounter. Patient denies any past surgical procedures. No social history such as caffeine, alcohol, drug use obtained during this encounter. Immunization history, vital signs, and hospitalizations were not obtained during this encounter.
History of present illnesses. For current medical problem, A.B. states his heartburn symptoms have worsened. His current medical conditions are arthritis and calcium deficiency. There are currently no lab results or physical exam findings that were obtained during his encounter.
Currently, the patient is on 3 medications. The first is Tums 500 mg chewable tablets. The patient takes these for heartburn and calcium deficiency prophylaxis. The patient takes 1 tablet by mouth 3 times a day as needed for heartburn. The patient reports taking 3 doses daily. The second medication that the patient takes is Aleve tablets, the strength unknown. The patient takes this for arthritis, and he takes 1 tablet by mouth 2 times daily. The patient reports taking 2 doses daily. The third and final medication that the patient is currently taking is a multivitamin tablet. The patient takes this for general health, and he takes 1 tablet by mouth once daily. The patient reports taking 1 dose daily.
Drug therapy problem and goals of therapy. The drug therapy problem is indication and needs additional drug therapy. A.B. needs additional drug therapy to treat his symptoms of heartburn. Short-term goal of therapy. Eliminate A.B.'s heartburn symptoms in 14 days. Long-term goal of therapy. This indication does not warrant a long-term goal. If A.B. is still experiencing heartburn after 14 days, A.B. should be referred to his primary doctor.
Review of systems. A.B. denies symptoms of a GI bleed. He also denies constipation and diarrhea. The remainder of A.B.'s review of systems is unremarkable.
To resolve the patient's drug therapy problem, A.B. will begin taking ranitidine 150 mg tablets. He will take 1 tablet by mouth 2 times daily. The patient will start taking this medication to decrease his heartburn symptoms, and he will take it with water 30 to 60 minutes before meals. Ranitidine was chosen over omeprazole and esomeprazole as the patient will receive relief from his symptoms faster with ranitidine. Also, esomeprazole was more expensive. All other medications for the patient are indicative, effective, safe, and convenient, so the patient should continue taking these medications.
Plan for follow-up. Follow-up should take place in 14 days, which is 5/7/19. Follow-up will take place face-to-face to evaluate to make sure heartburn symptoms are eliminated. If A.B. is experiencing continued heartburn symptoms, then the ranitidine is not effective, and we would refer the patient to a primary care provider. For safety, we would evaluate and look for signs of adverse effects such as nausea, vomiting, constipation, headache, or abdominal pain. If any of these occur, the patient should discontinue the medication and look to switch to a different one. If the patient experiences low heart rate, dizziness, or yellowing of the skin, the patient should immediately stop the medication and seek medical attention.